Next group of methods is additional group, additional methods. And there are several methods: thermometry, electroodontodiagnosis, radiography, vital staining, luminescence, trans illumination, laser flowmetry. First one is thermometry. This is determination of the reaction of tissue to the action of thermal stimuli. Thermal stimuli. It may be heat or cold. An intact tooth with a healthy pulp reacts to the temperature below about 5 to 10 degrees and above 55 to 60 degrees. In caries, the tooth reacts painfully to the temperature below 18 to 20 and above 45 degrees. So to determine the reaction to cold, we use cold water irrigation, ice, dry ice, chlorophyll. And to provide cold test, for example, cold water, ice, aerosol, freons, you can see the cold test. And another opposite test to cold is heat test, to determine the reaction to hot, not to cold, just hot water, about 70 to 80 degrees, heated tool, and hot gutta percha. Next, second method, also additional, EOD, Electroodontodiagnosis. It's the technique based on the fact that diseased and healthy pulp tissue have different electrical excitability. A healthy nerve responds with pain sensation to the effect of current intensity of 2 to 6 microampere. And this is special device to provide electroodontodiagnosis, pulp tester for EOD. And this device consists of exactly and 2 electrodes. This is like hook, passive electrode, which is fixed to the lips, and another one, this is an active electrode, is placed on pre-dried tooth, like this. This is passive hook on lips, and this is active on tooth. Tooth with cavity or on the surface of the tooth most sensitive to electric current. For example, in the middle of the cutting edge or front buccal hillock. Gradually increase the current using special button to a small feeling in the tooth, and patient should feel some sensation, some not first feeling, and next it may be weak pain. So patient informs us about this feeling, and we look at the screen and we can see some number. And indicators: healthy teeth, normal reaction from 2 to 6 microampere. During deep caries, it may be about 15 to 20 microampere. During pulpitis, different indicators from 20 to 80 microamperes, and periodontitis more than 100. Pulp is dyed, so it is not react to any electrical stimuli, electrical current. And as for equipment, pulp tester like this, like previous slide, you can see number of electrical current, and for example like this digitest also for electroodontodiagnostic EOD. And also about EOD, delivers a small electrical stimulus to the pulp. Factors that may influence reading. It may be teeth with large restorations, teeth with more than one root canal. Dying pulp can produce a variety of responses. Wetness on the tooth during testing, and batteries in the tester may be weak, so it may flew the indicators. Next method, number 3, radiography. We use it to determine the hidden caries cavity, determine the depth and communication with the tooth cavity, and sealing quality also. For example, in this picture you can see just changes of color, not caries cavity, and also here. And in X-ray picture you can see changes which is caries cavity. So this method, X-ray, helps us to determine caries cavity and its depth. Here, caries cavity you cannot see, and after preparation it exists caries cavity. And classification, radiological classification of caries cavity by depth. We use it when we characterized caries process, different caries classes. So K1 first. K1 is cavity within the enamel no more than its half. This is K1, not deeper than half on enamel. This is enamel, this is dentin, and this is pulp. So K1 changes in only in enamel and also not deeper than 1/2 of enamel. K2, affected enamel more than half, not reaching the enamel dentin border. This line is enamel dentin border, and K2 caries cavity more than 1/2 but not penetrate into dentin, not reach the enamel dentin border. K3, this one K3, enamel and dentin caries less than half the thickness of dentin. K3, in dentin, also in enamel and also in dentin, but not deeper than half of thickness of dentin. And K4, also in enamel, in dentin, but more than half, deeper than half of dentin, but not reach the pulp. More than half, but not communicating to the pulp cavity. This is pulp cavity, and caries cavity, which is K4, not penetrate into this structure, this caries cavity. And the last one, K5, defect penetrates into the tooth cavity. Enamel, the whole enamel, the whole dentin, and even penetrate into the pulp cavity. 1, 2, 3, 4, 5. 5 classes of caries according to radiological classification. Next method, we continue additional vital staining. Vital staining is used for differential diagnostics of caries in the stage spots with non-carious lesions, assess the quality of edge sealing, and first we should clean the tooth from plaque and then apply the dye, some color. Then wash it off and evaluate the intensity of staining. First, clean tooth, then dry a little bit, then apply the color, the dyeing, then wash it off and estimate. Coloring materials. Methylene blue 2%, methylene red about 0.1%, and some other like carmine. Detector, caries detector, red, for example, red detector or blue detector it may be. Next method is luminescence. Luminescence is based on the different ability of tissue to reflect ultraviolet rays. It is used for determining the age fit of fillings, recognizing initial caries, and the study using Wood's rays is carried out in a shaded room from a distance about 20 or 30 centimeters. Equipment, we use microscope equipped with quartz lamp with a filter made of dark purple glass. And similar method, which is called trans-illumination. Next additional method is trans-illumination. The shadow formation observed when light passed through the object of study is evaluated. This study is carried out in dark room using a lamp polymerizer. In caries, a limited hemisphere of dark color is determined. In acute pulpitis, the crown of the affected tooth is darker than the crown of healthy teeth. In chronic, there is a relatively dim glow of the hard tissue of the tooth. Trans-illumination also reveals enamel cracks and sublingual dental deposits. You can see lamp, light for polymerization, and we can see shadow. And next method is called laser flowmetry. Is based on the analysis of the optical properties of tooth tissue when they are irradiated with a laser. The reflected light wave is converted by the electronic system of the device into digital indicators on the display, or an audio signal, allows to identify changes in the structure of enamel, and is used to diagnose the initial forms of the disease, as well as to evaluate the effectiveness of remotherapy. And equipment which is used for laser flowmetry is Diagnacam by Cava company.